What is up everybody, it is Jay here, and today we are going to be talking about top surgery. I have not had surgery yet, as most of you will know, but I did recently book my surgery. So I will be having surgery on the 12th of July next year in Florida with Dr. Garamoni, and I wanted to talk about how I picked Garamoni, why I picked Garamoni, so hopefully it helps other people who are going to be having surgery pick what surgeon they would like. There's two disclaimers for this video. The first one being that money was not a large deciding factor in what surgeon I chose, because my parents were willing and able to pay for my surgery. As a result, the money was not as large a factor. And the second disclaimer was that there is a surgeon in Ireland, but I was never a massive fan of her results. I didn't want them on my body, and as a result, I never really considered her, and I always knew that I was going to have to travel. So the travel aspect was not a big factor in whether I chose a surgeon or not, because I kind of always knew I was going to have to travel anyway. The first thing that I think you need to work out when you are talking about picking a surgeon is figuring out what it is that you want from your surgeon to begin with. Partly because you need to be able to talk to your surgeon and communicate with them what it is that you want in your results and what your concerns may be about your results, and partly because in order to narrow down what surgeon is going to be right for you, you need to know what kind of result you're looking for. Obviously, there are different types of top surgery that are suited to different types of people. There are different methods, per se, of top surgery that are more suited to different bodies and different chest sizes. And on top of that, each individual surgeon would have their own method. For example, there are plenty of surgeons who do double incision, which is the two cuts directly across your chest. But some surgeons do double incision and don't use drains. Some surgeons do use drains. Some surgeons have like really flat, straight cuts. Some people have really curvy ones. Some of them have diagonal ones, you know. All the surgeons do surgery slightly differently. So you need to go and research, like, okay, how does this surgeon do this thing? What's up with that? How does it work? Is this what I want on my body? Is this the result that I want to have for the rest of my life? Combined with that, you need to know what you have to work with. You have to be realistic about your own body as well. If you are a stick insect, so if you're a stick insect, then look at results of people who are also really thin. If you're really muscular, look at results from people who are really muscular. If you're chubbier or heavier, then look at results from heavier guys as well. You have to look at results not just where the final product is what you want, but where the before image is similar to what you look like now. That is a big help in being realistic about what results you're going to get, because obviously we all have grand desires about surgery, but surgery isn't always going to be 100% perfect and 100% what we imagined. So we have to be realistic when we look at results images and when we think about what we want. I've talked a lot about results already, so I'm going to talk about results images now. The number one place, in my view, to find results images is a website called Transbucket. I will put a link in the description down below. It is basically a website where you have to sign up, and it does ask you to be over 18, but nobody's checking. And it is basically like a photo bucket website for results of surgery. It has all sorts of different surgeries for both transmasculine and transfeminine people, top surgeries, bottom surgeries, different types of top surgeries, different types of bottom. Like, you can really go narrow, and you can see results from specific surgeons and only see results from specific surgeons. And I think Transbucket is probably the most helpful and the biggest database of surgery results that you can find online. Outside of Transbucket and a surgeon's own website as sources for results images, I think it is a really good idea, if you want to have surgery locally, to engage with online or in-person support groups. There are groups on Facebook for trans guys in Ireland, and that's where you see most results images from the top surgeon in Ireland. Most of those images are available in these private groups, but not necessarily elsewhere. And it's really beneficial to talk directly to somebody who's had surgery with that surgeon, because they will have a first-hand experience to tell you about, and they can tell you, like, well, I liked this, I didn't like this was good, this was bad. They can give you that information directly. So this is another factor as well. If you have a friend who's had surgery with a specific surgeon, that can also be really helpful as a source of information as well. One of my friends had surgery with Dr. Garamoni earlier this year, over the summer, I think. And so I have I have another person's view on what surgery with Garamoni is like, somebody that I know personally, and I've seen his results personally. So that helps me to make a decision about whether or not Garamoni is the right surgeon for me, because he personally had surgery with him. He's really happy with his results, and his results look great. So in general, that's just another way to pick the right surgeon. And last but not least, if you can, get out there and talk to the surgeon. I know that I had a phone consultation in order to book my surgery with Dr. Garamoni, and he was really good and he was really nice, and I had the opportunity to ask questions about surgery. So in that situation, you have the opportunity to ask a question, to put any questions out there. That is a good opportunity to take. I didn't really have any questions, but like, if you did, and if you wanted to talk to a surgeon about something specific, then you need to go out there and take that opportunity, because it's better to ask these questions than to not ask.